All right, we're recording.
Hi, my name is Heather Bui-Whitlatch. Welcome to Team 50. Today's presentation is on scope of practice. We're going to go around and introduce ourselves.
My name is Brendan D'Souza. I'm from the College of Medicine.
Hi, my name is Michaela. I'm with the College of Nursing.
My name is Nicholas Mondo. I'm from the College of Medicine.
Hi, I'm Ellie Khan. I'm from the College of Pharmacy.
Hi, I'm Melissa Sarmiento, and I'm also from the College of Pharmacy.
All right, so we're going to go ahead and get started. I'm going to start with the background of this case. This case follows the Logan family in a rural setting who have sought care from their school nurse, as the closest clinic is almost 2 hours away by car. This is a family with 7 children, and the 9-year-old Michael is the one seeking care, as he has an elevated fever and some submandibular swelling. The school nurse attributes this to being a cavity, and she considers either pulling the tooth out or sending the child home with some antibiotics or Tylenol 3 from the local hospital that she works at. The ethical dilemmas are as follows. Firstly, what is the scope of practice for each professional named in the case?
Well, Ms. Evans is practicing out of the scope of practice in nursing. This is considered an element of malpractice under the duty owed, resulting from failure to communicate the change in patient status to the doctor.
None of the elements of this case are within the nurse's scope of practice at all. She doesn't have the scope to prescribe drugs or perform what she deems a necessary treatment, such as pulling out a tooth.
I agree in this situation. She should contact the doctor or the dentist to try and see if they can come in an emergency or do a home visit.
The nurse practitioner, healthcare provider could also just reach out to an available physician, or if it's an emergency, they could drive to an ER or seek emergency medical help or care.
Okay, so how can interprofessionalism address the situation?
The school nurse should definitely call the dentist without making assumptions as to what is actually going on with the child.
For me, I would affirm that the nurse has good intentions, but also explain to her the dangers of working outside of her training. And I would try to instruct her, well, I would instruct her that under the Good Samaritan Act of 2008 is the only time that she should act in an emergency to try and to stop and intervene to help when there's no one else with higher qualifications around to be able to assist her. And any other situation would be out of her scope. It would be dangerous to the child or the other individual.
Pharmacy could provide references for low-income families to help address the financial aspect, as well as provide consultation that indicates them not using the medication until further fact-finding is indicated and utilized.
Okay, so what are the risks of administering medications without authority? I say she could not administer medications without doctor's order under the American Nurse Act, as it is a liability.
And even further than that, as the school nurse is not an advanced practice nurse, she doesn't have any prescriptive authority according to the Texas Board of Nursing, and diverting medications from the hospital to treat a patient outside the hospital is both dangerous and illegal.
In addition to the legal consequences, there could also be medical consequences. As we all know, medications do have side effects and can cause reactions or worsen the patient's medical status.
There could also be contraindications with medicine used. So if the patient is harmed, she can be sued for malpractice, which puts her job and license at risk.
Just as Alyssa and Brendan had mentioned, it is illegal to not provide the patient with this medication, but also it's very dangerous as it could lead to several adverse effects. And there's honestly just not enough data found that could be taken into consideration for this medication to be safely used.
Yeah, just for an example, as it pertains to this case, giving opioids in this situation can cause respiratory suppression. On top of the fact that there's a submandibular mass that is causing inflammation, can lead to airway obstruction. These together could lead to respiratory failure.
When is it appropriate for health professionals to work outside the scope of their practice? And by what is performance outside the scope of practice judged? It's only appropriate when the situation is life and death involved, and it must be able to save a life and not worsen it, like performing a CPR.
The scope of practice is determined by the regulatory bodies for each practice. So with this case, the nurse would be having her scope of practice judged by the ANA and the nurse's scope of practice document.
It would be okay to act outside of a personnel's scope of practice in the event of an emergency, but only if no other qualified personnel is available.
I agree with Brendan. Outside of that, that specific time, it would be dangerous.
Has the school nurse exhausted other courses of action for treating Michael Logan?
In this case, she actually has not. She could look for other resources for the family or call for help.
Yeah, exactly. She could call the dentist or the doctor and see if they have advice for her, as well as also see if there's potential for them to come out and help with her.
The nurse should consider telehealth, using telehealth communication to reach out to other dentists and get consultation.
The nurse could also reference the family or contact a local pharmacy herself for consultation on using Tylenol #3.
What are the implications of health literacy for this family?
This is an important question. The biggest implication would be that the poor knowledge of healthcare resources that are available to them has actually led them, ended up leading them to seek care from someone who may actually not be qualified.
Further, as they live in a rural setting, they need to be instructed, at least with a very general set of knowledge on how to spot what would be emergencies with the health of their children, so that they can seek help in those situations and not get to the point where there's no one available to be able to assist in those emergencies. Further, they need to get some advice and some instruction as to what resources they have available, so to decrease the cost of their healthcare, such as GoodRx, Medicaid, Medicare, and the Texas Marketplace, so that they can find health insurance or healthcare coverage at a reduced rate.
Okay, so this concludes our presentation. Thank you.
Yeah.
Thank you.